To get started, inform parents about the purpose and need for newborn screening. Instructions for blood collection and handling can be found on the back of the blood collection form. Do not touch the filter paper portion of the form or allow it to come into contact with anything other than the infant's blood. Using a black or blue ballpoint pen, fill out the form accurately, legibly, and completely. Be sure the correct information for the infant whose blood you are collecting is written on the form. This will help to prevent delays in locating an infant who may need another specimen or require evaluation. To begin the collection process, gather your supplies. You will need gloves, a soft cloth, sterile alcohol preps, sterile gauze pads, a sterile lancet with a tip that is approximately 2 to 2.4 millimeters in depth, the blood collection form. Now begin the procedure. Wash your hands and put on the gloves. Moisten the soft cloth with warm water up to 41 degrees centigrade. Place the infant's leg lower than the heart to increase venous pressure. Warm the heel with a softened cloth for 3 to 5 minutes. Warming the heel will increase blood flow and help you to collect a valid specimen. Clean the heel with an alcohol prep. Wipe dry with a sterile gauze pad and air dry. Alcohol left on the skin may dilute the specimen or cause hemolysis. Such a specimen will be rejected. Puncture the heel. The puncture should be made on the sole of the foot, medial to a line drawn from the middle of the big toe to the heel, or lateral to a line drawn from between the fourth and fifth toe to the heel. Do not puncture the posterior curvature of the foot. Do not puncture a previously used site. Wipe away the first drop of blood with a sterile gauze pad. The first drop of blood may contain tissue fluid that could contaminate or dilute the specimen. Allow another large drop of blood to form. Lightly touch the filter paper to the large blood drop. Either side of the filter paper may be used, but apply blood to one side only. Allow the blood to soak through and completely fill the circle. Touch the heel to the filter paper only one time. Very gentle, intermittent pressure may be applied to the area surrounding the puncture site. Fill in all of the circles. Do not use capillary tubes, venous blood, or means other than the heel stick as described, except in extenuating circumstances in which the child's condition necessitates an alternate source of blood. Do not touch the same circle on the filter paper to the blood more than one time. This will cause a layering effect, rendering that circle unsuitable for testing. Do not milk or squeeze the area around the puncture site. This may cause hemolysis or allow tissue fluid to mix with the blood, leading to incorrect results. If the blood flow decreases, repeat the collection procedure, selecting a different puncture site. Allow the specimen to air dry completely on a flat, non-absorbent surface for at least 4 hours. Keep the specimen away from heat and direct sunlight. Do not touch or smear the spots. Do not place the protective cover over the blood until it is completely dry. Do not refrigerate the specimen. Never superimpose one filter paper on another. Your specimen should look like this. Valid specimens have blood applied to all of the circles. The blood must fill the circles completely and soak through to the other side of the blood collection form. Several things can affect the quality or the quantity of the blood collection, resulting in a specimen that is not suitable for testing. Number 1. A specimen with a quantity of blood that is insufficient for testing may be caused by removing the filter paper from the drop before the blood completely filled the circle or soaked through to the other side, or by applying the blood to the filter paper using a capillary tube or needle, or by allowing the filter paper to come in contact with gloved or ungloved hands, or substances such as hand lotion or powder, either before or after blood collection. Number 2, a specimen that appears scratched or abraded can be caused by applying blood with a capillary tube, needle, or some other type of device. Number 3, a specimen that is still wet when received will not be tested. Do not send the specimen before drying a minimum of 4 hours. Number 4, a specimen that appears supersaturated is caused by applying excessive blood to the filter paper, usually with a device, or applying blood to both sides of the filter paper. Number 5, a specimen can appear to be diluted, discolored, or contaminated because the area around the puncture site was squeezed or milked, or because the filter paper came in contact with gloved or ungloved hands, hand lotion, or powder, either before or after blood collection. Number 6, a specimen can exhibit serum rings which may be caused by failure to remove alcohol from the heel before puncturing the skin, by allowing the filter paper to come in contact with alcohol, hand lotion, or other substances, by squeezing the area around the puncture site excessively, by drying the specimen improperly, or applying blood to the filter paper using a capillary tube. Number 7, a specimen can appear clotted or layered because the same circle on the filter paper was touched to the blood drop several times, or the circles on both sides of the filter paper were filled.